Hi, good afternoon, everyone. Hi, I hope you can see me and hear me all right. My name is Maria Bertone, and I'm one of the facilitators for today's skill building session on doing political economy analysis, challenges and approaches to ensure the relevance and policy uptake. Thank you for joining us and welcome to the session. Today, we're going really to focus on some of the challenges that we have encountered when doing political economy analysis. In particular, as I said, in relation to ensuring the relevance of it and ensuring the policy uptake. We're not going to go very much in details on how and why we do political economy analysis, although I will touch on that in the introduction just now. But we'll really try and focus on what are the practical challenges of doing that, and in particular focus on two challenges that we highlighted in our own practice, and we'll just review them and reflect together with you about what were the approaches that we found useful to deal with them. So yes, you can see up here a little bit of an overview of a session. We're going to go through a little bit of an introduction and then focus on one of these challenges, the reflexivity and positionality one, and then have a little discussion with the audience. And we really encourage you to share your views and your experiences on that. Then we have a second part on stakeholder engagement and research uptake in political economy analysis. And again, a little bit of a discussion before we wrap up and conclude. But first of all, let me present the team. So today, it will be me, as I said, Maria Bertone, lecturer at Queen Margaret University. I will facilitate the discussion and go over a quick introduction with you. And then for the first part, it will be Ibrahim Bouorm, he's a PhD candidate at Queen Margaret University based in Lebanon. And with him, Dr. Elko Jacobs of the KIT in Netherlands. For the second part, it will be facilitated by Kathilat Bello, a researcher at Serud in Benin, and Julia Lofreda at Queen Margaret University in Edinburgh. And then finally, the wrap-up will be done by Dr. Jean-Paul Dessous, who is the director of Serud in Benin. So this is us. You have our pictures, and hopefully you will see us as we switch on and off cameras, and we'll have hopefully a lively discussions with you later on. As I said, this is really, it's marketed as a skill building session, right? But what is mostly, it's really an experience sharing session. We're going to reflect together and exchange about what were the challenges that we found in relation with those two approaches, those two issues that we found in doing political economy analysis, and really welcome your reflections and your thinking. And in this sense, please remember to use the live Q&A box for any question, comments, and reflection. We will try to monitor that as we go on. The Q&A box is found not on the Zoom, so not on the platform where you see the presentation, but back on the conference platform. You probably already know that by now, but that's where we're going to collect all the questions and answers. So to start with, I'll go through a very quick introduction of why, first of all, why political economy analysis? And as I think I can't really, convince you already. You probably already know this if you're participating to this conference. Health systems are shaped by socioeconomic and political factors that define the choice, the design, and the implementation of health policies. And therefore, gaining a better understanding of health policy processes is really essential to unpack the reason why health systems are shaped the way they are, to identify challenges, and perhaps if we want to go background noise. If everyone can mute themselves, that will be very useful, and then we'll get to the question and answer, and we'll be able to provide join us. Is that okay? I think it will be easier if we, since it's a lot of us, I can see it's about 50 people here. So I think it will be easier if we can just only have a little bit of presentation, and then I will stop and take question. And as I said, it will be much easier if a question, they come into the live question and answer box, Q&A box, rather than opening mics, if it's possible. But if there is any burning issue, I'll get back to that. Thank you. Sorry for that. This is just how the way it is, and it's just a shame that we can't be there in person, and it will be much more participatory, I would imagine. So yes, so as I said, then I was saying, you know, why do we want to do political economy analysis? And the idea of gaining a better understanding of health policy process and then potentially trying to influence them. That's what we want to do. And that's why in terms, for example, in terms of progress towards better health, and we have worked quite a bit on UHC and universal health coverage in terms of a goal of a health system. This is inherently a political process. So it entails power and contestation of resources, but also the interest, ideas, and ideologies play out. And this is why political economy analysis offers a tool that allows us to unpack and have a better understanding of that. So next slide, please. Yes, so what is political economy analysis? And the very broad definition that it's given by DFID in this case, and the definition that I've chosen and picked up, is that political economy analysis brings together the economics of reform with the politics of change by looking at how power and resources are distributed and redistributed, and how interest, incentives, and institutions enable and hinder change. So as you can see, this is a very broad and very open definition. And indeed, political economy analysis is a set of approaches and a set of tools, I guess, in order to be able to unpack the policy process. So, for example, if we look at this slide, next please, this framework that I've chosen, which is one of the possible frameworks to use for political economy analysis, and it's the one that is called the problem-driven political economy analysis. We can see that once we have identified a problem, we can look at the technical and economic solutions that are there and that are providing us possible and feasible solutions. But we can also look at the political economy itself, so the political economy of that problem, of that specific problem. So we can look, for example, at the structural factors, the historical legacy, demography, geopolitics, socioeconomic issues, political context, and so on, that define how the policy process is organized and what are the consequences of it. The second element that we would try to unpack is what we call the institution, which are the rules of a game that can be formal, for example, the rule of law, the rule of democracy or election or electoral rules, but also can be the informal institution, for example, the cultural or the social norms. And finally, and critically, we look also at actors, what we call the stakeholders, and how their interests and incentives and the different agendas and how they use the power that they have, how power is distributed and how it is used, and how this affects the outcome of the policy process. So it is this bit that what political economy analysis tries to unpack and understand. And political economy analysis can be done for different reasons, for different aims and objectives. So we can do analysis of policies, for example, to try and understand why a policy came up, or specifically why that content was defined. And usually this is done retrospectively, looking back at how decisions have been made or taken. But we can also do analysis for policy. And one of the questions already before the session was already about how we can get policymakers to use it more explicitly in order to define the policy process in advance, or to try and influence that. So in this sense, it could be more similar to policy advocacy or information for policy. But this is a general overview. What we want to look and really focus on today is on specifically two particular challenges that we have found that relate to the political nature of political economy analysis, and in particular to the complex relation between researchers and stakeholders. So here, for example, we usually see the relation between the researcher and the stakeholder as rather a linear relation. The researcher, they create knowledge and evidence, and then they share it with stakeholders for them to hopefully at least use it in their decision-making and their implementation processes. But when we look at political economy analysis, things are much more complex because of the position of stakeholders, who are not only knowledge users, but they can also be a study subject. They are part of the framework, as I just presented to you. They are an element of the framework that we're using, but they often are also co-producer and research participant, because they are, for example, our key informants, they are a participant in our focus group discussion. So this is already one of the challenges. And then in relation to the second challenges, next slide, we believe that there is an additional challenge in the fact that researcher and research team have their own position, the values, their background, the views that they have on the subject of the research. And this mediates how they see the issue and also what they want the stakeholders to think about that. And researchers can be external or far away from the context, but they can also be immersed within that. You can see the little man within the broader group. And that really defines and really has an influence on how the research is carried out, how data are collected, how data are analyzed, and so on. So these are really the two key challenges that we want to focus on today with you. In the first part, we're going to look at the challenges in relation to reflexivity and positionality of a research team. How does the position of a researcher or of the research team influence the access that they have to stakeholder and to information, and how they frame the research question and how they do analyze them? And then in the second part of the session, we're going to reflect and really exchange our experiences and hopefully also get your views about how to do stakeholder engagement and research uptake, in particular for political economy analysis. Given the multiple roles of stakeholders, as we said, within and as research participants, knowledge users, and knowledge producer, how can we ensure their participation, ensure their engagement, and ensure that the findings have analytic relevance and are useful for them. So these are really the two key issues that we want to cover today and discuss with you. Next slide, please. So we have a couple of questions that we would like to put up to you and that we will use to guide the discussion after each of the presentation. First of all, there is a poll that you can answer to, probably you have already done, whether you have used political economy analysis before in your research or in your organizational practice. And then we have a couple of questions about, first of all, about your experience on positionality in work that you have done, not necessarily using political economy analysis, but in general, and the challenges that you faced and the approaches that you use to deal with it. And the second question that we would like to discuss is, have you disseminated political economy analysis findings? And if so, how, and what was your experience with that? So we had imagined that as a discussion in groups, and unfortunately we cannot use groups given how this platform works. So we're going to have to do it in a kind of a very big group of 50 people, but hopefully we'll work out and we'll be able to share some experiences and some views. So please do post in a live Q&A box, and we will pick up your questions and have a discussion at the end of each presentation. So I'll hand it over now to my colleagues, Ibrahim and Elko, for the first part of this session on reflexivity and positionality. Thank you.
Thank you, Maria. Hi, everyone. I'm very pleased to be able to present to you, have this opportunity. It's a shame I can't see you all, but I'm very happy to hear your thoughts later on and have a bit more interaction later on in the Q&A. So my name is Ilko, and I'm speaking to you from foggy and cold Amsterdam, where I work at the Royal Tropical Institute. And I'll be talking a little bit about this issue of positionality and reflexivity in relation to political economy analysis. So, yeah, these are difficult terms. What do we actually mean by it? Now, positionality can be seen as the wider contexts and identities of a person that affect both interpersonal relations and the research processes. And it stems from the understanding that people have multiple overlapping identities, and they make meaning from these various aspects of their identity. So researchers and interpreters and all those others that are involved in the research process all bring their own assumptions into the different steps, all steps of the research process. And likewise, research participants, for example, interviewees or focus group discussion participants, also make meaning of the researcher's position from their own identities, different aspects of their identity. Now, this is inevitable, but it can be mitigated. The influence of it can be mitigated on the research process through reflexivity. And reflexivity is the process of being able to examine one's own positionality and how this influences what one thinks. It requires an immediate, dynamic, and continuous self-awareness in the process of research to deconstruct one's positionality, ultimately to be able to produce a more trustworthy, transparent, and honest account of the research. And of course, it touches upon power relations, how people see each other, how they perceive also the power of each other's roles. And it's important to note here that power relations between people in the research team, for example, the lead researcher and assistant researchers, are not necessarily fixed in stone, but they're fluid and change throughout the course of the research period, or at least they can change, with lead researchers maybe being in a stronger position to define the agenda in the design stage. But in the data collection phase, assistant researchers take quite some prominence, and also their positionality is also very important to take into consideration. Next slide, please. So what's the relevance to health systems and policy research? Well, first of all, as Maria explained, political economy analysis is an emerging track in health systems policy and research with several methodological challenges. And one of these challenges is how to deal with positionality. But despite the interdisciplinary nature of health systems and policy research, researcher positionality is actually rarely discussed in this field, unlike, for example, in medical anthropology. Now, there is sort of emerging work on with anthropological lens in health policy and systems research. And yeah, we feel it's important to also highlight the advantages of that. Because actually health policy and systems research is done by quite a variety of researchers from different disciplines, all with their own disciplinary biases. There's quite a number of people with a strong background in public health, also economists, sociologists, political scientists, etc., etc. And this disciplinary background really frames for people what they perceive as important to look at in health systems and policy research. So the researcher characteristics and their relationship with the policy community also could affect the research process and also the outcomes in political economy analysis. Particularly because political economy analysis touches upon conceptualizations of power, social roles, and fairness in the distribution of resources. It really depends on how researchers see that. And we like to think there's consensus on this, but there's also maybe subtle differences in what we perceive as fair or how we see justice in power relations. So that really influences researcher positionality. Okay, the next slide. So because we're talking about positionality here, we also felt it's important to say a little bit more about our own backgrounds. Now, I am a Dutch national and I work at a Dutch Knowledge Institute, and I did my PhD at a Swiss university and my master's in the UK. So I'm trained in Western Europe and I work in a Western European country and institute. I'm a social scientist by training, it's my background. And in this next few slides, some insights we shared from several of my studies, including a study on the political economy of health financing reform and governance in Tajikistan, and on a study into the politics of priority setting health services in South Sudan. These were embedded single case studies based on both literature review and key informant interviews. And the poster on the research in South Sudan is available with the poster gallery. And this is the moment I'll hand over to Ibrahim, who can also introduce himself here.
Yeah, thanks so much, Alco. So yeah, I mean, before introducing myself, so technically, yeah, as Alco said, so we're trying to introduce ourselves is not just to actually connect with you. And actually, it's pity that we're not being able to connect like previous conferences and so on. But I mean, the aim here is just to introduce ourselves and then reflect on how this positionality would affect our how to do, let's say, our way to conduct political economy analysis. And that's the point. And that's why we're trying to give a bit of background on ourselves before going into the details. So yeah, my name is Ibrahim. I'm a Lebanese national. I'm a medical doctor by training. I have a background in public health, initially in epidemiology and biostatistics. So you can see from which background I'm coming. And I had before doing research in specifically and looking at the political economy of Ncds in Lebanon, I had this previous experience as an NCD consultant for the Lebanese Ministry of Public Health. And then when I moved to Edinburgh for being within another positionality, meaning an NIHR doctoral fellow at the British University, and now I moved into looking at this problem from an academic lens. So I'll be drawing insights from my study on the political economy of NCDs in Lebanon. And it's an embedded single case study research based on a review of peer-reviewed publications and the gray literature using the same framework that Maria used in the introduction. And as Alco clearly mentioned, so we're not talking about the findings of our research. We will be reflecting on experiences throughout the process and how perhaps our positionality and our background has affected the research. But I mean, a bit of marketing here. So despite the focus of the session is on the how to do political economy analysis, specifically in terms of positionality and reflexivity and dissemination, the results are the highlights of the results of our work, whether my work or Alco's work are available in the poster gallery of this conference. And we kindly invite you to please go and have a look on them, and please come back to us with questions if you have any. Yeah, please, next slide, Julia. So let's start with the first challenge in terms of our positionality vis-a-vis the research, and actually try to separate between us as researchers and the research itself. So the first challenge, especially for political economy analysis, and Maria mentioned it very clearly that here we're not talking about an intervention assessment. We're talking about powers and interests and ideas of different stakeholders, especially to maybe change this status quo, but sometimes to block any policy process, especially even if it's related to population health and improvement of population health. And we know it from different examples. So now when we need to do such research, actually the key challenge overall, I mean, throughout all the process and all the outcomes of the research is how to reconcile actually our convictions and emotions on those power issues, governance issues, and sometimes our perceptions, whether as an insider or an outsider to the policy community or the policy context, with actually the need to have an objective result or an objective approach and have an open mind to do research. And this is somehow the key challenge as researchers. And sometimes we will go now on to discuss what are some barriers or maybe some opportunities for being an insider or an outsider and having this different position and its impact on the research. So sometimes being an insider, like my own experience with the Lebanese community, the policy community, might be an issue, right? So because you are now coming and to actually explore power dynamics and policy making, but usually when we talk about political economy analysis, we're talking about failures in policy, whether creation, implementation, or uptake. So meaning that we are coming here to look at problems. We're not looking. So, and this might be an issue, but sometimes your positionality as an insider would help you to be able to connect with those people. You don't have any language barrier. For example, if you are an outsider like Alco's case, so he might have these language barriers, especially for his case studies. He had this language barriers, but and this is not just the part of the problem. The main problem for him as a researcher is being actually, and it's not just about being, but is seen as an outsider, and especially as he clearly mentioned, so being, for example, coming from a Western European country and coming into Central Asia or African countries, and especially if he has this appearance of being the doctor or the donor or an NGO representative, that might be linked to an authority, even if whether he has it or not. So sometimes people, whether research participants, policymakers, might look at him as having the authority. They might be intimidated to join or to reflect freely on their perceptions, and that might be an issue, and might affect the policy process and the results. Now, if we move one step further in our work, and then we try to look at our background and how this background might be linked to challenges in terms of political economy analysis. So I'll give you one example. So I had this clinical practice background. We are sometimes labeled as those who look at just at the technical issues as biomedical person, and especially my previous background in public health was focusing was in epidemiology, meaning that actually our focus is usually on those technical approaches, whether to health issues at the individual level or at the system level, and we are looking literally at the prescription to be made to that problem rather than the overall context. And also sometimes our experience before going into political economy analysis might affect our ability and the results of political economy. So for myself, when I started this first work in political economy analysis, I had a very limited expertise in health policy analysis to be added actually to that background. But sometimes, even if you take Alco's background, he's a political scientist, right? He's a social scientist, and he somehow is quite familiar with those problems of political arrangements, power imbalances, governance issues, transparency, accountability, corruption. But sometimes he might be having this limited expertise in the technical component of the problem. And if you look at again, if you reflect back on that framework that Maria showed at the beginning, you have this technical part of the political economy analysis. So what are these technical components? But then you will be investigating the political economy of whether taking these onto consideration, implementing them or not. So technically, but sometimes you need to have this background and this understanding, whether a health system background, and try to understand these technical issues. And for a social scientist, sometimes it's an issue at the beginning, especially if we're discussing, for example, a clinical perspective on of a problem or of a disease. So that's again another challenge. Again, we need to reflect on another thing. Now, our positionality might affect actually our ability to get and to access actually and collect relevant data. So here, I mean, and again, as Maria clearly mentioned at the beginning, so we are reflecting on experiences. We're not saying that we are expert in this, but just, I mean, these, and we're happy to hear your thoughts about it. So probably an insider might have an easy access to collect relevant data and the ability to collect relevant data, but sometimes actually, because especially if we're talking about a short project, or I mean a very tight deadlines, and you know, all of us deal with those the rigid deadlines, if I may say. So in that case, an insider might be able to capture these relevant data quicker than an outsider. And but sometimes you have another challenge from being within being an insider. And here I'm using the definition of insider just being, let's say, having the same nationality. But sometimes if we need to reflect on other things, sometimes insider means that you are part of this institution, and then for let's say the Ministry of Public Health or another NGO, and you are reflecting on a policy dynamics that you contributed to or your institution contributed to. And this is actually another example of being really an insider within the system. Sometimes the challenge here is that you might not be easily, or you not be at ease actually to select a high the method that you want. So in Lebanon, actually, I had this dilemma whether or not to collect primary data, because I mean, if you go there and you ask people about power, but they know you, I mean, they might be intimidated to share informations, and especially if we are discussing those sensitive topics. So this is another issue. But while if you are an outsider, and I'll discuss it in a while, you might be at ease to actually ask questions. But being an outsider within political and doing political economy analysis in local context probably might be linked to greater difficulty actually in identifying those relevant stakeholders, those people who can share with you information, or maybe sometimes to actually, sorry, can you hear me?
Yes, we can, Ibrahim.
Oh, thanks, Julia, because I had something changing on the screen. Okay, so yeah, I was saying that actually probably an outsider might have this difficulty to identify those relevant stakeholders and to access documents, and that's what happened with ALCO in Tajikistan. I mean, being able, as I said previously, with those language barriers, being able to connect quickly with those stakeholders, whether at the stage of doing the analysis or later in the stage of dissemination, might be an issue. Next, please. Other things that we need actually to reflect on as researchers in relation to doing political economy analysis is our ability to capture those power intricacies. So sometimes being an insider, and I mean, because the key point is, especially, I mean, especially that these power intricacies are sometimes hidden, right? And they are not labeled clearly, and they are not, especially if you need to look at the literature, they are rarely discussed in the way that you might want them to be. And technically, so you might have this problem whether or not to capture them. So an insider might have this higher ability to capture them, and sometimes to understand historical legacies of power dynamics, meaning what happened before that, because they understand the context, they understand sometimes the institutions themselves, they understand actually how people are connected in that policy process, and how actually probably what are their ideas, their interests, and etc., and so on and so forth. And the issue is that for an outsider, maybe they might be less aware, as I said, especially if we're talking about a very quick assessment or analysis of the political economy of a problem, let's say, or a sector or a country. So they might be less aware of that context. They might not be able to capture those specific dynamics, especially around gender, hierarchy, ethnicity, class, etc. So, for example, if someone comes to Lebanon, maybe some problems and dynamics around religion, etc., might not be captured right away compared to someone from that context and being there for a while. Actually, beyond that, when you need to go and do primary data collection, let's say, whether using semi-structured interviews, focus group discussion, even, or any other participatory research methods, an outsider might be not really able to have this flexibility to ask critical questions, especially if he or she was a part of the policy network or the policy community. And I'm not just talking about policy making, maybe it's just researchers. So you know that actually us in local context, so we know those people. Even as a researcher, we've done several projects, we explored several research questions, and we contacted them. So we have that kind of relationship that might limit our ability and the flexibility to ask those critical questions. Whereas ALCO, for example, in South Sudan, let's say, maybe he can be forgiven for asking naive questions. And by naive, we mean actually naive, well, intentionally or unintentionally naive questions. So they can say, okay, tell me a bit about those dynamics and why, for example, that stakeholder had that position vis-a-vis of the policy uptake, etc., etc. So because, I mean, ALCO is not seen as a direct threat, because it's not part of the system. But here I need to say something really essential, because I mean, my colleagues Julia and Kefi will be discussing this research dissemination. I mean, and this is something that we need to reflect on. But what if actually we will be disseminating researchers? Are we still being excluded from the system, or are we now part of that system? And this is another thing that probably we need to reflect on, because research dissemination for policy uptake and joining those cycles of policymaking and research might actually lead us to be part of that community. And you know that academia actually contributed to many changes in policy. I can take the example of tobacco control in Lebanon and our experiences with that. So academia was part of those people joining this policy process and having position vis-a-vis of policy content and different scenarios. So yeah, now if I need to move further in the process and look at data analysis, our positionality might affect our ability to have personal biases in doing data analysis. And maybe for me as an insider and doing political economy analysis in Lebanon, of Ncds in Lebanon, and being part of this community might affect the objectivity and generalizability of research findings. But I mean, I need to stop for a second and ask ourselves, and ask myself and ourselves actually, do we really care about generalizability of political economy research findings? I mean, well, sometimes probably we're not talking here about, I mean, probably we don't really care about the generalizability of the findings. Probably we are interested in generalizability of the method itself and its use and the contribution of that research into changing the policy. So, but I mean, we need to reflect on those. We need to keep in mind that those things are actually essential in doing research. Sometimes, like ALCO's situation in Tajikistan, South Sudan, so he actually might have this ability to be, if I may say, bias-free, in a sense that he doesn't really have those personal biases vis-a-vis the community or the context, whether around gender, class, ethnicity. But at the same time, as we said earlier, this positionality might be, if I may say, a barrier to have this in-depth analysis and in-depth understanding of the context. And finally, if we need to look at after this exercise of political economy, what would happen after this exercise? So political economy analysis findings, let's take the example of tobacco control. And if we're discussing conflict of interest, or we're discussing, let's say, governance issues, integrity of some people, might be sensitive. And the sensitivity of those findings might affect actually us as a researcher if we publishing them right away and then trying to be objective, because you have connections with the policy community, whether as an insider and sometimes as an outsider. You will be there for another project, for another collaboration, and that might affect your future opportunities to connect, maybe sometimes your future career opportunities. I don't know. So technically, this is again among those things to be reflected on. And one final point under this chapter of positionality is sometimes we have some commitments to our institutions. So ALCO's study in Tajikistan is based, actually he was based in a social science faculty, and they had this policy to favor actually single author publication. But as we've been clearly saying, political economy is a tough exercise and it needs collaboration. But here's another institutional limitation to actually being able to start this collaborative analysis and move forward. So that's me. I mean, I'll hand it over to ALCO to reflect on actually mitigation strategies and how beyond the reflexivity, you actually try to address those challenges in doing political economy analysis. And I'm happy to take questions in the Q&A box. Thanks.
Thank you, Ibrahim. Yes, so how can one mitigate these dilemmas, these challenges in terms of positionality and enhance reflexivity? Well, we use a number of ways to do that, and we're not perfect, so it's not that we achieved 100% success with this, but these are a number of ways to mitigate positionality. First of all, the data collection method was something that we thought about and we had to make choices in depending on our positionality. For example, Ibrahim chose to, as an insider in Lebanon, chose to rely only on document review because of the sensitivity in approaching former colleagues or people from the environment in which he also worked previously. And also the selection of appropriate analytical approaches is necessary here, and or theoretical tools, because they can allow for adaptation and refinement in the research process to mitigate positionality. And here, although Ibrahim chose to rely on document review only, he found the use of the problem-driven model very useful, as it gave very detailed and more structured guidance to the analysis process, allowing him to make the most of the data. Other ways, for example, what I used is more principles from grounded theory, treating the data collection and analysis process as a interrelated dynamic process, again allowing for refinement and adaptation as you go in terms of data collection. Obviously, and this is also what Ibrahim referred to, diversity in the research team is essential, including both insiders and outsiders with different backgrounds and relationships, to mitigate those challenges related to being either an insider or an outsider, and also to make use of the opportunities they offer. And lastly, at least I used also taking of field notes and comparing my field notes with those of the person I was conducting research with, who was an insider, to see if we had interpreted what was coming out of the interviews similarly, or if we had different interpretations depending on where we came from and what our baggage was. And next slide, please. Other generally useful ways to enhance reflexivity is research diary keeping. And that can be just in addition to just the field notes of like where you've been, whom you talked to, what your impressions were of what the research participant said, can be a more deliberate, reflexive journal in which one can reflect on the choices and decisions made in the research process, the reasons for these, personal reactions, perhaps emotions also, to research situations and relationships. That could allow for more honest and deliberate, explicit reflection on the research process as you go. Of course, verbal collective reflexivity in research teams, so that also should happen within diversely composed research teams, but also with research participants, particularly if, let's say, you use methods beyond standard interviews, such as participant observation and open informal dialogues. This reflexivity can also be introduced. That could allow for more open discussions about how different positionalities affect the research and the findings from the research. And of course, immersion in the research context is quite important for outsiders who are not familiar with the context. And immersion doesn't necessarily only need to be living with your research participants for 1 or 2 years, but can also be done through good proper exposure to local media, extensive reading about the research context, talking to people also about the research context slightly beyond the strict research theme. And these are just some ways one can also use to mitigate one's positionality and aim for more reflexivity. That was it for this part. We really welcome your questions and be happy to answer them as much as well as we can. So fire away. Ibrahim and I are ready.
Thank you. Thanks, Ibrahim and Elko. I think that was very, very useful and very enlightening discussion. And I really like the juxtaposition, in a sense, the comparison between your experiences and the fact that, you offered some practical tools. And to me, the way Ibrahim adapted his work, in particular in terms of, thinking through the research methods and about this issue of not being able to interview. I mean, interviews are oftentimes our main methods. And so having to go around that was particularly interesting to hear. And I think it's really interesting what you said, Elko, about working in teams and note-taking. I was, jotting down, and I think that's, that kind of explicit reflexivity and positionality reflection. I think that's very, very useful. I'm going to check if there are any questions already in the question and answer box. Please, everyone, feel free not only to put up questions, but really to reflect on your own experiences of, what was your position, what was your reflexivity processes that you had to go through in your own research. So I think if you have any of that, please post it in the Q&A box, or just raise your hand and we will see if it's possible to to open the mic and give you the floor for a quick question or a comment or a reflection. Really, that's was meant to happen in a group. So unfortunately we can't do that, but we really would like to keep it as open and participative as possible. I think there was one question that was already there from earlier on in this, when we started the presentation, that was from Felix, that he was reflecting on how we can do and get researcher and development partners to really push for the use of political economy analysis in a prospective way. So in the sense that it's used as a tool to improve policy development and implementation. And that is, of course, it's a good question. It's a very difficult things to do. And we might reflect a little bit on that in the second part. But I was thinking, maybe you have some reflection on this issue, thinking about how to do political economy prospectively. And in particular, are there any specific positionality issue in that? Because I'm thinking if we do it prospectively, positionality is even more a concern, because I think perhaps going back to Ibrahim's example of the tobacco control policy in Lebanon, that was kind of defined at the same time. I think that might be interesting to reflect a bit on that, or perhaps from you, Elko, on your experience in Tajikistan and South Sudan. Was any of that perspective? And what do you think are the specific positionality issue in prospective political economy analysis?
Okay, I'll start very quickly to just share one idea, perhaps, and then yeah, I mean, sometimes doing prospective political economies is essential. It's like doing prospective policy analysis, so trying to somehow predict certain positions of stakeholders and how that might affect their relationship with the policy process. And this somehow this anticipatory exercise might help us to have a better impact in policy change as researchers. But then I think the key challenge, or from a positionality perspective, is what is our position here? Are we part of the community, a policy community, I mean, or are we being neutral researchers, if I may say? And the second point that I wanted to try to highlight on is actually doing this exercise prospectively might be essential, especially if we try to do what's called research co-production, meaning that trying to connect with policymakers and do it actually in collaboration with them, and invite them to join this research exercise from the beginning, from the conceptualization phase until the data collection. And here maybe even if we are somehow introducing a kind of bias, but the ultimate aim is to try to push policymaker, unless, I mean, we don't reflect on that, that might be an issue. But if we do reflect on that and we try to explain the potential impact of that bias on the research outcome, then for me, that would be very helpful. And that's a good reflection. I mean, Alko, would you like to add something?
Yeah, in terms of doing political economy analysis prospectively, I think this is obviously very context dependent, and it really depends on where the researcher stands, what his or her affiliations are. Now, there can be, political economy analysis is a big part of it. Is also trying to understand what interests of different actors are, right? What motivates them, what incentivizes their behavior. Now, the researcher, of course, also has interests in trying to see what the power landscape is for a certain policy change, and his or her position towards the policy change might play a role there. I think, yeah, currently we're in the process of designing a study in South Sudan at the county level and below to understand the political economy of resource distribution and use in relation to primary care, because South Sudan is at the moment rolling out BOMA Health Initiative. The BOMA Health Initiative is an initiative to strengthen community health and accountability towards communities. And this, the idea is to introduce these BOMA health committees, but we're also of the position that these structures need to adapt well to existing power structures, and at the same time work towards inclusion, be a more inclusive governance arrangement in an environment that's also plagued by conflict and power abuse. This is difficult to reconcile. So if you would find a power arrangement that is actually already rather participatory, works well as in terms of a channel for voice for people, perhaps you might conclude that this new BOMA Health Committee is not entirely necessary in that particular context. I think these are dilemmas that we'll be facing, and that would count also for other contexts, but it's so highly context dependent.
Thank you, thanks. And I think there is one question that kind of links on what we were just saying now, Elko. On this, this context specificity and how we see things differently. The question is, can you explain some of the findings, some concrete results of your political economy analysis projects, and how these, so I suppose how the findings were affected by your positionality? Have you any concrete example of that? Things that you think the way you have interpreted might have been influenced by your position, or the way, or perhaps moments when you stopped yourself from doing that, or you reflected out loud on how to do or not to do that? Again, drawing on your own experience. And we're happy to hear everyone else's experience if you want to raise your hand and contribute. Elko, do you want to go first, or Ibrahim?
Yeah, okay. Well, one example I think is that perhaps, if I'm very honest with myself, in Tajikistan, I not overestimated, but I paid a lot of attention to donor-driven policy changes and the importance of that and the role of donors in it, and not necessarily positively only, but at least the emphasis on the research topic was also shaped by by my position and the access I had to research participants. And I of course, I did talk to and interview Tajik officials, quite a range of them, and health providers. But still, the easier access I had to donors and NGOs perhaps made me overemphasize their role in the process.
Thank you. I think many of us can relate here. Ibrahim, do you want to add anything?
Yes, yes, Maria, thanks. I mean, it's a very important point. Yeah, I mean, I can reflect on my experience with the political economy of Ncds in Lebanon, and doing problem-driven political economy analysis is somehow an analysis that focuses on 3 steps or 3 components, if I may say, as clearly shown in your slide, Maria, on the problem-driven political economy analysis. So after looking at those structural things and then the institutional things, meaning the health system institutions mainly, and you need to do a kind of stakeholder analysis and to see actually who might, actually what's the position of each stakeholders and the power level, and doing it without actually doing a primary data collection might have affected might have affected the results. And the second point is, especially when I discussed, I mean, sometimes for tobacco changes or NCD risk factors, you might find some papers discussing this and hinting into those dynamics. But sometimes if you're discussing something around care model changes, probably you can't find all the details that you want in the literature. So again, my positionality and its impact on the method itself might have affected this. And then my second point here is, if your positionality within the system maybe can lead you to use your own interpretation of things rather than, if I may say, valid evidence from the literature or from a well-conducted research projects. And this is another issue. So for me, many for many examples, I was like, okay, but this is what I think about this, but where is the evidence to support that point, to support this, if I may say, this analytical step in the whole case study, and that was a key challenge. So that's mainly to answer this question. But Maria, if I may just add something to the previous discussion about retrospective and prospective analysis. I mean, probably in political economy analysis, especially if I look at problem-driven political economy analysis, usually, I mean, it's somehow reconciled retrospective and prospective views, if I may say, or analysis, because it's not like looking at one policy and trying to investigate it, whether retrospectively or prospectively, to see what should be the content, let's say, etc., and how to move it forward. In political economy analysis, you're doing this analysis at things going on later and probably in the future, reflecting on them. But actually, there is a component then which under practical implications. So if we are doing political economy analysis, we should be keen to reflect on implications of the analysis. So somehow, if I may say, just actually political economy analysis, it's different of just doing a one health policy analysis, because it allows us somehow to look at things in the past and then just project things in the future. If that makes sense.
Yeah, yeah, and we'll get back to this debate later on. So that's very useful to introduce the next part of the session. I can see there is one more question that perhaps Ibrahim, you can address maybe in writing later on. It's from Tala. She's asking if there is any publication on political economy analysis specifically in Lebanon. So maybe you will have some reference to suggest. Ibrahim, and there is also, earlier on, there was a question about general literature on doing political economy analysis, kind of basic methods and references. And I think there are some references at the end of the presentation that you can have a look at. So we'll get back to that. And also, I think the WHO Alliance, Lucy Gilson's health policy reader, health policy analysis reader. That's a particularly good reference for people who want to start reading and getting kind of immersed in that type of literature and analysis. So is that okay, Ibrahim, for you to address the question in writing?
Yeah, I mean, yeah, so or 1 second, I can answer in 1 second, just to say that actually it's a new field, especially in the Lebanon and in the Middle East. There's, I mean, I don't think that we have much literature. But I think one publication came out from colleagues from the R4HC project, I think, if I'm not mistaken, looking at political economy of health in general in Lebanon. And I mean, I didn't honestly get the opportunity to read it, but it was communicated by colleagues from AUB, King's College, and other partners. And for political economy analysis of NCD, so hopefully it will be out in the coming month. So yeah, but I think these are the two key publications from Lebanon and probably from the Middle East.
And your poster is there, so people can go and have a look at
that.
So definitely encourage everyone to do this. So if there are no more questions, I will go on to the second part of this session. And but don't worry, we'll have time to get back to your question and again also on positionality later on in the final discussion if you have more thoughts on this or you want to share your experience. So the second part is, sorry, that was a question for the first part, but for the second part, we're really looking, and we already touched a little bit upon that, on the issue of stakeholder engagement and research uptake, and thinking about how we manage to do that, given that stakeholders are not only knowledge users or research users, but they're also part of the environment, and researchers are part of the stakeholders environment and the arena where all of everything happens. So how do we manage that, and how do we in a way, how do we do stakeholder engagement specifically for political economy analysis? So I will hand over here to Julia and Kathy for the second part.
Thanks, Maria, and hello, everyone. My name is Julia Lofreda. Sorry, technical issues. Hello, everyone. My name is Julia Freda. I'm a researcher at the Institute for Global Health and Development at the Queen Margaret University. I have a particular interest in the political economy analysis of universal coverage and non-communicable disease policy implementation, and also on research uptake and stakeholder engagement. So as Maria said, at this point, we would like to reflect on some important aspects of doing political economy analysis, which are actually, yes, research uptake and one of its components, such as stakeholder engagement. So the Department for International Development defines research uptake as including all the activities that facilitate and contribute to the use of research evidence by policymakers, practitioners, and other development actors. So in general, research uptake activities aim to support the supply and usage of research by building commitment of research user to access and use research evidence, but also ensuring that the research questions are relevant. And additionally, communicating, synthesizing, and repackaging research for the different audiences, and building capacity for understanding the research findings. As you can see from the image, research uptakes includes all these different components such as stakeholder engagement, capacity building, communication, and monitoring and evaluating uptake. So the general literature on research uptake has reflected on the best strategies to ensure the engagement of the stakeholders and achieve research uptake. Some of the strategies, we picked just some of the strategies that generally are mentioned, and these include, for instance, establishing an early and continuous engagement. We all know that the uptake of the findings into the programming should not begin or end with the delivery of the final study output. So it should be an ongoing throughout the exercise, and based on the regular communication between institutional staff and research team, for instance. And in order to establish a common understanding of the purpose and the scope of the work, this communication should begin even before the analytical work itself commences. Other challenges can include, for instance, increase the opportunities for researchers and policymakers to meet and share ideas. And this can be done, for instance, setting up regular communication mechanisms between the stakeholders. And other ways to achieve the best research uptake also can include, for instance, building infrastructure to support policymakers to access the information, like, for instance, hosting a website for the ease of research output access. And additionally, it's important to ensure that the fundings are translated into actions, and which depends on bridging the analysis and the follow-up action. In this process, obviously the research output should not be seen just as an input among many. And so there will be value in many cases to compare the theories of change and reflect between the theories of change in the current and the past programs and projects, and how these changes of the change of processes that can appear plausible in the light, particularly of the political economy analysis. And so in particular, when research uses our political economy approach, and what needs to be uptaken are actually political economy findings, there are additional challenges to that. And there are some challenges that we have identified, for instance, through our project. And in this case, we draw mainly from an ongoing project, which is funded by the National Institute for Health Research on the political economy of universal coverage in the Francophone Africa, like in Benin, Mali, Cameroon, and Burkina Faso. And the project is still in the initial phase, and it's focused mainly on partnership development and stakeholder engagement to prepare a future project. And my colleague Kathy Bello will discuss just in a minute will draw on the examples from this project, but also from other ongoing projects. And for instance, from one project to provide technical assistance in Togo and Benin in advance the universal coverage agenda with prospective policy analysis on the main universal coverage reforms. Anyway, some of the challenges that are in common to any research uptake strategy, for instance, some of these challenges are common, but others are more specific to a political economy analysis work. And we have included here on this slide some of these challenges, which, for instance, can include obtaining and maintaining engagement, and also ensure a common understanding of political economy analysis concept. As my colleagues already mentioned, political economy analysis includes, usually use really a broad range of approaches. So also having a common understanding is not always easy. As also Maria mentioned before, the stakeholders are the knowledge users, but also are the study subject, and often the research participants and the co-producers of the knowledge, which add an additional challenge. So at this point, I will now pass over to my colleague, Kathy Bello, who will talk on approaches that we have used or thought of to address these challenges. Thanks, Kathy.
Thank you, Julia. So next slide, please. So the first step when we are doing stakeholder engagement, and also for any research uptake strategy, is to do a stakeholder mapping exercise. And this is where actually the first challenge with political economy analysis work comes. So stakeholders can be mapped as part of the research process, so as actors in the political economy arena, but we can also map the stakeholders as actors that we need to collaborate with. And usually we have the question to, are these two processes separate, or are they the same one? And are the stakeholders that we map for the research process are the same as the one we map for the research engagement and for collaboration? So we do not have an answer to this because it depends on the context, the topics, and the aim of the research. And for instance, for our current NHR project, we wanted to involve the stakeholders in the development of the research question. So and also because of the way the development award is set up, we are starting with stakeholder engagement, and then we will do the research. So the stakeholder mapping we did was really to look at who we need to engage with in order to identify the real needs. So, and because we start with this stakeholder engagement, it's likely that when we will do the mapping for the research project, we will have overlaps between the two lists of stakeholders. So this is really something we need to think of when we are doing political economy analysis work. Next slide. Next slide, please. So another challenge is obtaining and maintaining the engagement of the stakeholders. And for this, one thing we found useful is to make explicit what the stakeholder can, what is in for the stakeholder to engage with us. So how engaging with us with our work can help them in their daily work and also in what they are trying to achieve. And we found here some reason while we were discussing within the research consortium, but also drawn from the literature. And one reason we can present to the stakeholder is that by engaging with us, they can be able to access and understand more research. They can also be able to gain new knowledge and tools, be able to network with other stakeholders, and also to see a bigger picture in the policy making and implementation processes. And here we give an example from Togo, when we were supporting the Ministry of Health in developing a roadmap to advance UHC in this country. We found that helping the stakeholders to network with each other through a co-creation workshop, and also providing them with up-to-date information on the UHC landscape in the country really helped us to obtain the engagement. And we could really have the engagement of this stakeholder throughout the whole co-creation process, because we were able to show them how engaging with this process can help them to better understand the UHC landscape in their country, but also seeing how their own work can fit with the work with others. So this is really a key lesson that we learned from engagement in Togo. Next slide, please. So another challenge in the stakeholder engagement while doing political economy analysis work is ensuring that the stakeholders have a good understanding of political economy analysis concept. And here, I will give an example again from the NHR project. We started this project by trying to do a sort of baseline assessment of political economy analysis knowledge. And we found that not always a good understanding of what political economy analysis is, and the stakeholder usually struggle to engage with research which uses that approach. And I remember in Benin when we were doing the interviews, one common comment that really come is, well, political economy analysis, what is this again? What are you bringing again in? So it's important to provide this stakeholder with a good knowledge of political economy analysis and a good skill. And indeed, to illustrate this we could see in the interviews that we could some reflection that shows that there is really a misunderstanding or a partial understanding of political economy analysis, even if sometimes we found an intuitive use of this concept. And the first quote you see here really shows a misunderstanding of political economy analysis, while in the second quote, the stakeholder is trying to explain it, and we can see a partial understanding. So he said that we need to understand the process to be able to improve it. So it's a partial understanding, and then we see that he brings something else, and we could see that it's really important to update this knowledge and skills. And in the last quote here, there is a representative of a private sector association who shared an experience and said that they work by finding advocacy element to open up the dialogue. And they tried actually to negotiate with the government, looking at the position of the government. So you can see here that there is an intuitive use of political economy analysis concept, but as my colleague Jean-Paul used to say, it's good to have this intuitive use and knowledge, but it would be better if we can provide them with the right skill and concept so that they will be able to better use the political economy analysis concept. And this also a little bit give an answer to the first question by Felix, who was asking how we could help policymakers to engage in political economy analysis. Next slide, please. So another challenge is, and Julia already said it, is about the sensitivity of political economy analysis. So, and political economy is by definition sensitive, and navigating these sensitivities is complex. So we found in the mediation dialogue building the literature this diagram that is that can be useful actually when we are trying to engage with stakeholders, especially when we are sharing the funding of political economy analysis. And one key lesson here that we learn is that it's always good to engage in non-threatening ways. And in this diagram, at the position level, you usually have sensitive topics, like for instance in the UAC landscape. So what should be, for instance, the implication or the role, the right way to engage with private sectors, but we can try to focus on the need and fears area where usually you have non-threatening topics, and you have a more chance to have common understanding and common views on some topics. And here again, I can give an example from Benin, where it's very sensitive actually to discuss of the new health insurance schemes that is currently ongoing in our country. And what one approach the facilitators of the dialogue platform that was set up to follow up and to monitor these schemes is really to try to focus the discussion around commonly agreed learning questions. So even if sensitive issue would be discussed, it's usually through these non-threatening issues that are usually technical, and it's helped to have more constructive discussion and to have discussion on these sensitive issues in really a way that will not threaten the key stakeholders. Next slide, please. And another challenge when we do political economy analysis is to try to match and to conciliate the research cycle and the policy cycle. So we often look as researchers at our own research cycle, and we state that we should engage from early on or from the beginning of the research cycle. This is important and relevant, but we should also take into consideration the policy cycle, because sometimes when we start our research, the research can start at the very beginning stage of the policy cycle, but it can also start at any stage of the policy cycle. And the way we will design our research project and the way we also engage, are different throughout each step of the policy cycle. So maybe we need, actually, not maybe, but we definitely need to adapt our research cycle to the policy cycle. So sometimes we need to accelerate our own research process to really fit with the policy cycle, or sometimes we need to adapt and provide support and maybe try to slow our research cycle depending on how the policy cycle is evaluating. And in this sense, we can also link this with the prospective policy analysis, especially for the reforms that are at the earliest stage. And it's usually helpful to do this prospective political economy analysis. So usually what we see in the literature is that policy economy analysis is often retrospective. So looking back at what has already happened, and for this reason, it might not always offer practical help to policymakers to decide what to do. But as Ibrahim said, we can also combine this retrospective political economy analysis with prospective analysis that will allow to engage stakeholders in dialogue that go beyond the technical issue. So they will be then able to understand both the technical issues, but also the political context in which these options are immersed. And this may help them to be more able to influence policy change. Of course, this has a lot of constraints, a lot of and potential disadvantage. For instance, it needs a lot of time, it needs more resources, and sometimes may not be useful for policies or decisions that were made in the past. Next slide. So I will stop here and hand over to Julia to moderate the Q&A session. Thank you.
Thank you. Thank you, Kathy. Thank you very much. I think that was quite clear. That was interesting to hear a little bit about, the approaches that you have used to stakeholder engagement. And there was one question about trying to bring in some of the experiences, like more kind of practical examples of what you have done in your project. And I was wondering, perhaps if you want to add a little bit, you already mentioned a little bit about the project in Togo and in Benin, that you're, in a way, you're documenting prospectively the process and the progress towards UHC. Maybe you want to say a little bit more on that, and perhaps Jean-Paul can add on in terms of what are the approaches to stakeholder engagement that you're using there. You mentioned the platform in Benin and other approaches in Togo. Can you expand a little bit on that to address that question?
Excuse me, Maria, I lost the connection for a few minutes, so
No
I couldn't hear your answer.
And Jean-Paul, feel free to jump in if you want to. There was one question about providing some more example. You already mentioned a few of the practical experiences that you had in Togo and Benin in engaging with the stakeholders for your projects on UHC. So perhaps you want to say a little bit more. You mentioned the platform in Benin, I think, and some other activities in Togo. Can you go back on those examples and expand them a little bit? Either you or Jean-Paul.
So maybe I will start with the example in Togo, where we really faced many of the challenges we exposed here. So the objective was to support the Ministry of Health to advance the UHC agenda. So there were some strategies that actually were stopped. So they were adopted, but then they were stopped at the implementation phase. Can you hear me?
Yes, we can hear you fine.
Okay, okay. So they were stuck at the implementation phase. And first of all, the first challenge was to obtain the attention of the stakeholders. So the Ministry of Health was convinced, we were all convinced as facilitators, but then we needed to engage with the high level, for instance, the presidency, engage with other sectors. And at the beginning, it was really difficult to do so. And as I said, what really helped to obtain this engagement, it's first of all, trying to base this dialogue on concrete facts, so on information, so providing the information to stakeholders on what is the state of UHC in this country, providing access to the right document, because not everybody had access to the document, and then trying during the co-creation workshop to really foster networking, to really show ways to collaborate, new ways to collaborate. So this is, for instance, a concrete example of how we tried to navigate these challenges we face. So maybe I can hand over to Jean-Paul so he can expose a little bit the example of Benin with the dialogue platform.
Thank you very much, Kefiat. So here we are advancing the reflection on data needed to conduct political economy, mainly when it comes to prospective policy analysis. A mechanism that can be in place to ensure that a continuous integration of uptake of output of political economy analysis into policy processes continuously. So in Benin, for instance, working closely with policy makers and policy implementers working on universal health coverage, a specific universal health coverage program in Benin called ARCH. The policy dialogue platform have been put in place, and this can be presented as a good example, as an example of how a collaborative joint learning platform can be used to generate information while continuously generate evidence, while continuously using this evidence to support the policy process continuously. We have grounded as a research institution supporting that process. We have developed a tool called the process documentation tool with a set of questions that help us to document continuously all the events and all the stakeholders happening in the course of this policy process. And that was quite interesting and useful to generate and reflect also on the positions of various actors influencing that policy process, as well as on reflecting on the position of us as a researcher and technical actors, so supporting the country in that process. To avoid being too long, I will stop there. If there are more specific interests on various aspects of how we are supporting the Benin, the UHC policymakers in Benin using some political economy insights, it will be very useful. I have seen Lucy Gilson in the list of participants. So just to mention that we are actively using one of the frameworks developed by Lucy Gilson to ground the way we are conducting, we are collecting information to do political economy analysis in the course of this process in Benin. Thank you.
Thank you, Jean-Paul. I think that was very, very useful to give us a very clear idea of what you're doing at the moment in Benin. And I think it really clearly relates to this discussion, how to engage stakeholders in political economy analysis. And one way is definitely to use it as a tool for support them in the process rather than look backwards in the process. Of course, it's two different types of analysis there, but it's still, it does answer some of our questions. And I wanted to say, perhaps, Elko, I don't want to call you on the spot, but I know you have experience in stakeholder engagement also in South Sudan. And I was wondering if you have anything to add and share your experience of how you did engage stakeholders on political economy analysis findings in South Sudan. And again, I welcome contribution from the audience if anyone has had experiences of doing that. We'll then get back to the questions about problem-driven political economy analysis in a second.
Yes, hi. Yeah, I'm happy to say something about that. We're right in the middle of sharing our insights and trying to see how to make them as useful as possible. Now, I have to go a little bit to also the content and what actually we studied in South Sudan recently. We looked at how priority setting of health services was how that process went, and because we noticed that in the framework of the Health Pooled Fund, which is a very large pooled fund supporting 80% of health services in South Sudan, and because of the very big share of donor funding as part of the total health sector in South Sudan, it effectively funds most of health service delivery in the country. In that framework, certain choices were made, or in that program, certain choices were made to support some services rather than others. And at the same time, other resources were and are not, do not totally match that. For example, the distribution of human resources. There's a contracting approach is chosen for the service delivery. So NGOs are contracted to carry out service delivery, one NGO per geographical area. And we saw quite some variation in what services were offered, the availability of certain services, and wondered like what interests played a role there, what were the power relations there, what was emphasized in the process of deciding on which services to support, and also in relation to the existing basic package for health and nutrition services. And we found that unsurprisingly, the donors of the Health Pooled Fund played a very large role in this process. But ultimately, because of the the large variety of demands, NGOs still had to do what's called implicit rationing of services. Okay, so that's the context. And that's sort of, the insights, like very shortly, the insights we gained from the study. So one of the insights, one of the recommendations from these insights was that this capacity to set priorities for health services needs to be more ingrained in at the Ministry of Health, or at least within the country, so that it's not an external consultant or just donors deciding on what the priorities of services should be. And we're trying to see how, to what extent donors might be interested in supporting something like that. And so if they would be supporting that, for example, setting up, well, in other countries, there's health technology assessment institutions, but it could also just be a unit for that or a few people with that capacity within the ministry. If donors would be supporting that, in a way, they're also undercutting their own leverage in deciding on what priorities should be set. So that's a bit of a dilemma, and we can only advise in a sense. But yeah, we're organizing different consultation and different moments to share our experiences and insights, and also offer maybe tools for making priority setting processes more transparent and fair. This is a way we're trying to use our results and broker our knowledge, so to speak.
Thank you. Thanks, Elko. I think that's very useful, again, to kind of have an insight of what's happening elsewhere. And I think it kind of brings out really the challenges that we have. It is a new field, there's not much done, and especially this kind of applied approach, the so what question that I've often been asked, like, okay, you have done this study, it looks retrospectively at all the dynamics of power, but then how do we use that? And of course, by using it, we might undermine the power of some of the actors, and so they might not want to do it. So how actually we do ingrain it within the arena we're actually studying? So that really is a challenge. And yes, and we really, again, we welcome reflections from others on what you have done and what you have, what were the challenges that you faced, and how you have addressed that. But I also understand that this is a relatively new field, and so the focus of this session was definitely not to tell you how to do political economy analysis, but was to go beyond that and focus on what the challenges are, in particular on, when you do it, what are the practical and methodological challenges. So that's what we focused on. But there is a question about more kind of basic steps about how to do political economy analysis. So perhaps, Ibrahim, you want to go through that quickly, just to give a little bit of an idea. That it's, again, as I said, it was not the focus of the session, and we provided some references at the end of the slides that we will post just in a second, and you will have in the recording as well, so that you can go and look at that. And I will post them in the question and answer box as well. But just to give you an idea, perhaps lately, but just to address one of the questions here, Ibrahim, can you go the slides and provide some explanation? Thank you.
Yeah, thanks, Maria. I mean, yes, indeed. So the aim, just very quickly, I will go over one example of how to do political economy. And as we said, it's an emerging track in health system and policy research. Usually it was it has been done and used previously by development agencies, whether the Fed, the World Bank, etc., to actually understand barriers to reforms in local settings. And usually, if I can use one of those DFID publications, I can't remember the reference, but so they discuss three types usually of political economy analyses. One of them is, it could be just a country level political economy analysis, looking at the political and economic context and how that would shape any policy reform in any sectors, focusing on these high levels, things of governance, and many other things. Sorry, can you hear me, Maria?
Yes, very well.
Yeah, perfect. Sorry. So yeah, I was saying that this one type of political economy analysis. The second type would be a sector level political economy analysis, and that example of political economy of health in Lebanon that I gave is somehow related to that kind of analysis. That meaning you can look at the energy sector or the health sector and see what are those dynamics that would allow or block changes within that sector. And the third part, which I found relevant for my work, was the political economy, so the problem-driven political economy analysis. In this one, you start by framing that problem, and you go beyond that to actually do the political economy analysis. But by framing the problem is that mainly looking sometimes at different perspectives of the problem and maybe sub-problems and issues. So from my example, let's say I can give at the same time some theoretical discussion, but also a practical example. I framed the problem of of non-communicable diseases in Lebanon, because I mean, somehow if we need to use system thinking language, we have some undesired behaviors in relation to NCDs. NCDs are still in the rise, and sometimes if certain if we can see some plateau, it's not what we wish to see in terms of dynamics related to morbidity and mortality. And the key concern for me, because I mean, this is the field that I'm interested in, and I've been working in for several years now. In NCDs, we are mainly also concerned about NCD risk factors and the policy landscape around NCD risk factors, tobacco control, etc., etc. So when you define this problem and you can see that somehow there is something wrong within under it, you can move into the second step of political economy, of problem-driven political economy analysis, and try sometimes to identify technical solutions, technical and feasible solutions, whether if they are existent or not. You can probably start by identifying them or bringing them from other contexts or from the literature. For example, for those who have this quite, I mean, they are familiar with NCDs, they probably know that we have a lot of success stories around the globe on how to tackle NCDs. One of them is this famous what we call them the best buys, so the WHO best buys for NCDs. Those highly cost-effective measures such as taxations on tobacco, etc., or reshaping the system towards primary healthcare provision of NCD services, and so on and so forth. So in that specific example of NCD being the problem, we have technical solutions, but as I said earlier, I mean, sometimes it's not about the technical component, it's about how to put them in place. And here is where actually political economy analysis comes in to look at mainly three layers. The first one is the structural factors, meaning what about the political context? For example, in Lebanon, I've reflected on these governance, general or big governance features in terms of control of corruption, in terms of how people can put in place, for example, policies that doesn't benefit the if I may say, the political ruling class, and so on and so forth. And we have here some kind of interesting references to use, whether some international database on governance features and so on and so forth. At the economic level, and this is relevant not just for NCDs, but if you're investigating NCDs within a UHC lens, meaning that you are also looking at reshaping the NCD care model. So technically you need to understand the economic context. In Lebanon, for example, you can see that we have several problems at the economic level. One of them is this, if I may say, blocked economic growth with a really problem. The analysis was even prior to the current currency problem. And you can see that actually you can look at how much, for example, the country has in terms of resources economically to maybe push forward a health system reform. And this also, you can look at demographic things like the refugee crisis in Lebanon, its impact, and so on and so forth. So, I mean, I don't want to spend a lot of time on this, but if you need to look also to do the political economy, a problem-driven political economy analysis, in addition to how this shapes the position and the power of stakeholders, you need to look at what actually do you have in terms of formal and informal policies or decision-making processes. So, for example, what about those tobacco control laws? Are they existent? Why and why not? And so on. What kind of reform happened in the systems? Reforms that happened in the systems in terms of reshaping the system towards maybe a comprehensive person-centered care model. And the last layer of political economy analysis, and actually, if you look at the slide, it's perfectly shown that actually these are should be studied in terms of interaction between them. So structural link to stakeholder interest and and their level, but how they shape institutions and how they change policies. So under the third point of stakeholder interest and constellation and powers, for example, we can do a stakeholder mapping. And I gave this example. It was challenging somehow to do it without primary data collection, but it just, I mean, it was a reflection on to put actually those stakeholders, to identify them and put them on a map in terms of their interest, whether to put those technical solutions in place or not, and the power levels. So for example, for NCD, a policy change, you might identify academia, civil society on that enabling part, while tobacco industry, any other private, for example, sector being in the opposite side, and so on and so forth. And as well for the NCD care model, you can identify those stakeholders and the relations. And from that, you can go into the last part to extract actually what should be done. And probably we can use a lot of theories from the literature, whether about health, usually from the health policy literature and the political science literature on path dependency in policies and other theories, to actually try to understand what happened and try to say how actually and what can best be done, as I mentioned on the framework, to make reforms happen and find a solution towards progress, if I may say, prospectively. So that's it in 3, 4, 5 minutes about the problem-driven political economy. And sorry for being very short.
No worries, no worries. Thank you so much, Ibrahim. I think that was really useful. And as I said, it goes a little bit beyond what we wanted to address today, but it addressed one of the questions, and I think it gives a little bit more background. So it's clear there that, you know, the stakeholders have a specific role when we do political economy analysis. And as researchers, again, we have such an ingrained role in the context that positionality becomes a very, very important issue to discuss. So I feel we have really touched on anything. I can't see any more questions today, again, I will ask if there is anyone who wants to share their reflections or any experience in doing that, and otherwise I will hand over to Jean-Paul for some concluding thoughts. Jean-Paul, over to you.
Thank you very much. This has been a very engaging, a very interesting session. I see in the list of participants some very key actors I know in the field of global health, and also others I am very interested to continue, that our team will continue working and discussing with. So we are open. You have our details. Eventually, Mari can share that, and you can engage with us for more direct and more personal questions, and for more collaboration on the issue of political economy analysis. So our overarching goal is to build a team, is to increase the group of actors and actors capable and equipped to start reflecting on those issues. And this is our aim, and we have been very happy to be supported by the National Institute for Health Research to start building a network across various countries and starting this engagement process with the global health community to ensure that in West Africa, in Francophone Africa, but also beyond, we have a growing and critical mass of actors supported by institutions and equipped with some concrete tools to start working in their context with various stakeholders to increase the number of actors working on political economy analysis. So that is as a general comment, and I really welcome you and thank you for participating in this session. So I will share some final notes in 2 main parts. The first part will be around the first part of this discussion. So in the first part of this discussion, I think what came up for me strongly is that we can come back a bit on the and reflect a bit back on the concept of objectivity. So, what does it mean to be objective? So, being objective, as defined by Tom Shatfield in the Critical Thinking book, is trying to understand something from a more neutral perspective, rather than relying on a single opinion or the first piece of information that comes to hand. I think that has a clear link with the issue of positionality, of position and reflexivity. Since it's also linked with the concept of bias that is defined by approaching something in a one-sided way that creates a distorted account of the way things actually are. And the whole idea here is that we can have what we can call conscious bias. They are bias we know. We know that we know deliberately that we have some bias, and we can account for them. And that is more, I will say, that is more easy to approach. But what is probably more dangerous, and that came across this discussion several times, is the problem of unconscious biases. So when someone's opinion or decision are distorted by factors that are not even aware of. So imagine as a researcher that there are some factors that distort your analysis, your readings of the facts, your analysis of the fact, the interpretations of the fact, and the way you report the fact, and you are not even aware about the existence of those factors that are biasing your opinions. And that is all what it's come about in terms of position and also on reflexivity. So the point that I try also to summarize by reflecting along this line is what are the kind of factors that can affect or distort or define my position when I'm conducting political economy analysis. Can this be factors like sex or gender? Can this be related to my academic background or my training? Can this just be related to my personal experience of life, personal life experiences, childhood experiences, my personal feelings, my spiritual opinions, my political opinions, my race, etc. And we can also link this back to the global discussion on coloniality and how, for instance, being a researcher from a former colonial country in a country that was a former colonialized country can distort the relationship, research relationship between the country where the research is conducted and then one considered as a principal investigator, etc. So in summary here, how do we deal with our unconscious biases when we go to the field to conduct research in general, and more specifically to conduct research related to political economy analysis? And here is my one of my key takeaway message that I want to share with you from this discussion. So 3 points to keep in mind: awareness, explicitation, and action, both working like in a circle. So trying to be aware of my biases. So try to be aware that I may have biases that are distorting my opinion every time I'm working on the field, or that are distorting my view of the situation, my understanding of the situation, and how I'm approaching the field. So just being aware is already something that can be very powerful as a researcher about positionality and reflexivity. So the other point is to try as much as possible to make my biases explicit. And eventually also, even when I'm discussing with someone with a strong opinion and a strong position about many things, to try to make explicit what are the factors that are driving his position. Is it his race? Is it his history? Is it his academic background, his political opinions, his spiritual beliefs? So what is driving my personal opinions, my personal thinkings and analysis and interpretations, and what is driving eventually the one of others in front of me? And then action, because we cannot just spend time doing political economy analysis without acting based on that. And when we act based on that, when we act based on what we make explicit from our personal opinions, then we can also learn from what is hidden in our mind, in our practices, in our behaviors, and that can help us to make them explicit. So awareness, explicitation, action, organized in a mutually influential way in circle. So about the second part of this discussion in terms of stakeholder engagement, I have just here two key things that I think we can keep in mind. I want to share as my takeaway messages. So the first one is that it is hard to think about conducting political stakeholder engagement in line with political economy analysis by just relying on external or by not having a kind of embeddedness in the context. So definitely we really need actors on the ground equipped critically to assess their context and help us help the fuel the global health level with critically collected, reliable information about what is happening in the context. I think if we fail to do that at the global health scale, we will just perpetuate some failures in policy making, in policy adaptation to context. And I think it is a time where political economy requires really stronger attention and really supporting in-country actors to do that the best they can is something we have all to push for. And this is the place to thank National Institute for Health Research for the trust they made in our young team and how they are supporting us to do that. The other point I want to raise is the value of data. So we cannot do analysis without good data. And how do we have good data about stakeholders, very sensitive data about their interests, about the power position, their influence, while using tools that are sometimes formal, others are informal. So do we need the data that are collected in an ad hoc basis, meaning that we came just for 2 weeks to collect data using the classical so-called mosquito data collection strategy? Or do we really need continuous sedimental way of collecting and processing data in context? I think I will vote more for the second part. And I think this is what also emerged strongly from the discussion today, that we really need in context one or another way to have continuous engagement with actors so that we can be we can be learning continuously and continuously improving and refining, fine-tuning our way of understanding actors in the context. This can just not be well done using ad hoc data collection strategies. So to finish, I think we are all here stepping into there are other questions that we can address later on related to the ethics of all of this. How do we discuss ethical aspects? How do we reflect on the economy of knowledge around political economy analysis and the nature of the data we use we need to do that. So this is like my key takeaway messages from this discussion. And I would like really to thank all of you for participation. I will hand over to Maria for eventually some last word before the end of this session in 90 seconds. Thank you very much, everyone. Over to you, Maria.
Thank you, Jean-Paul. I think that was very useful. A kind of a wrap up and take away point for everyone. And in particular, as usual, I thank you for reminding us of the importance of embeddedness of our research in the local context and the building of capacity at local levels, and especially for political economy analysis, this is particularly important. So thank everyone for your participation. Please do contact us if you have any more questions or queries,
And we look forward to seeing you perhaps in 2 years at the next meeting, or being able to interact in our research in some other forums. Thanks to the facilitators today, and thanks everyone for your participation. Bye, have a good evening. Bye-bye, or afternoon, or morning, wherever you are. Bye.
Thanks.
Bye.